All right, thanks. Yeah, welcome to this webinar where we will be sharing on the lessons that we've picked from our experiences working with a number of local government entities across East Africa. I can see Consolata Chando has raised her hand. The issue. Let's just hear what she has to say. Consolata, please, do you have a comment to make? Okay, let's proceed. Yes, so with me doing this presentation, three of our colleagues from our implementing geographies, one geography per country across the Kenya, Uganda, and Tanzania. So I will start off the presentation, and then at some point, I'll be introducing our guest speakers. I want to just also recognize participation from our geography implementers. I can see quite a number of them right across from Kenya, Uganda, and Tanzania. Welcome, as well as from GI. Next slide. Yeah, so about TCI is that TCI is a platform for scaling up proven high impact family planning interventions. That is both FP and adolescent youth sexual reproductive health. And TCI is an initiative that is led by the Gates Institute, which is based at the Johns Hopkins University. Next. Yeah, in terms of our broader goal, TCI, we basically envision a world where young people, women, and men are actually empowered to live optimal reproductive life. And we do this by supporting the local governments to scale up high proven impact interventions and provide reproductive health solutions. And our target are the urban poor. So TCI implements in a four-stage model. That is the first stage is where the geography is marketed to, and the geography expresses interest. And then once the geography expresses interest, we move into the design stage, where we co-create the work plan. And in doing this, we look at various parameters. And some of those criteria are the soundness, cost efficiencies, and the potential for impact of our interventions. Then once we are done with the program design, we then move to the implementation stage. And here is where now we co-fund the identified high impact activities. Once we run through the implementation stage, then the geographies are graduated, and we reduce our level of support to basically on a need basis. So that's basically the four-stage model that TCI implements. In terms of the timelines, as indicated in the slide, we have the startup, the implementation and such stage, and pre-graduation, and finally the graduation and beyond phase. And they are marked by the different time periods. As you can see, the implementation stage, which is the longest, it runs from 18 to 24 months. Then once the geography has implemented and we feel that they've achieved our different markers, then we prepare them for graduation and eventually transition them to to, the minimal on-demand support. Next. So in terms of our 4 foundational interlocking tenets, TCI believes that these 4 interlocking tenets are interdependent, and no single tenet can thrive in the absence of the others. We believe in scale, we believe in efficiency, we believe in sustainability and impact. And as in terms of scale, we catalyze the local governments to implement the high impact interventions to scale. And in doing that, then that creates an impact. And for impact to happen, we have to reach a level where we're operating, at a very efficient level, just so that at the time when we are transitioning, the local governments are able to take up and incorporate in their work plans some of the high impact interventions that will then lead to sustainability of their implementation. Next. Yeah, in terms of our footprint, like I mentioned earlier, we work across the 3 East African countries, Kenya, Uganda, and Tanzania, and we implement across 63 locations or geographies. Our current population coverage is slightly over 42 million, and so far, the commitments that we've gotten from our local governments are slightly over $6 million US. And from our achievement, so far we've managed to get over 2 million additional users by June of this year. Yeah, so in terms of family planning financing, as a platform and as a project, there are a number of activities that we put in place just to ensure that the financing for family planning by local governments is strengthened. Just some of the activities that we do are coaching of geography implementers, coaching them on financial management, budgeting, advocacy. We do forums where all the geography implementers, as well as the finance teams at the geography level, are capacity build on various aspects of management and finance documentation. And these are done through finance clinics. We also support them to do expenditure mop-ups through the different level facilities, just to ensure that whatever we are reporting as expenditure on family planning and AYSRH is actually accurate. We do support coaching on smart advocacy, again, at both levels, both technical and political leadership. And this is important because constant advocacy to us has demonstrated that we can yield fruits in terms of buy-in for family planning implementation. Then we identify the coaches and champions to support resource mobilization, to reach out to other partners who are operating within the FP space, all in a bid to ensure that we have sustained funding for family planning within our locations. Next. Yeah, in terms of a snapshot of how our performance has been with the financial allocation and expenditure in the last 3 government financial years, we have 2021, 2022, 2022, 23, and the current year, which is 2023, 2024. So as you can see, in 2021, we had a 40% expenditure rate. And then 2022, we moved to 74, which is as a result of the various efforts that we put in place. In 2025, we have not captured information for the whole year, but as at May, we were at 55%. We, however, expect the information coming for June to improve that position. But importantly, I think we also need to look at the absolute numbers in terms of our expenditure, because this is the actual money that went towards implementation of family planning high impact intervention. You realize that in 2021, despite a relatively low percentage compared to the commitment, we actually spent, the geography spent 859,000. Then moving to 2022, there was an increase of around 34% to 1.15 million US dollars. And currently, even before we close off the fiscal year, we are already recording a 10% increase from 1.15 to 1.266. So to us, I think that is a remarkable improvement in terms of the absolute absolute figures that are representing the funds that are going towards family planning activities. Yes, thank you, Jerry. So at this point, I want to welcome my co-presenters. I'll just introduce them. So we have Dr. Mary Christian Mokembe. Mary is a monitoring and evaluation specialist in Mbeya district in Tanzania. Then we have Shem Mutala. Shem is a public health specialist and an FB focal person for Jinja district in Uganda. Then we have Dr. Joy Mugambi. Joy Mugambi is the Director of Administration and Planning in Nakuru County in Kenya. So we'll start off with Shem. Shem, over to you.
Thank you so much, my brother, for taking us through. And I want to welcome everybody to the call. Yes, here is Shem that is going to give you an overview of how we have experienced the Challenge Initiative program here in Jinja District, Uganda. So to give you a very quick snapshot, Jinja District local government has about close to 600,000 persons as a population, and 24% of these are women in the reproductive age. And in this particular program, the Challenge Initiative, it is supporting 75 facilities across the whole Greater Jinja. These include 56 public facilities, and the rest are private facilities. And what is very key for every one of us to note that in this Challenge Initiative, for which we expressed interest in 2021 and started in 2022, we have had two major notable achievements. One of them has been the increment in the number of persons that are using services of family planning, up to 20% as of today as we speak. And secondly, that we have been able to improve and commit monies and funds to fund family planning services. Next. So these achievements that we are able to share with you as the whole world have been achieved through majorly 4 different activities that have been able to help us to strengthen the family planning financial systems. Important in every aspect of every program is the mindset change. And number 2 is having a shared vision. Once persons have a shared vision as leaders, be it the technical leadership, be it the political leadership, be it the implementing person, and finally the person that is using the service, if we have a shared vision and be able to realize where we are during the root cause analysis, and be able to understand that, yes, we need to change our thinking towards financing, that is a very big landmark, and which is very key that every one of us has to start with. First, in the beginning, as Jinja District, we actually initially thought that the business unusual model of the Challenge Initiative, as it is coined into the themes, was basically not possible, and because it was asking us to find monies and be able to allocate monies to finance family planning services. And initially, every one of us thought that it was impossible because we looked at around all the resources we had and it was looking like difficult. But after a few coachings and activities around us as leaders and the whole team, we were able to understand, and indeed mindset change was very key in helping us. And during these particular progresses, we were able to do this through co-design workshops that were able to help us as family planning programmers, leaders in different categories to be able to understand where we were at as a district and where we needed to move given our social demographic figures. These particular co-design workshops were also able to help us to understand the different high impact interventions and practices that TCI had already brought on board. And yet it is not just TCI, these are WHO researched and proven interventions that are seen to bring in results, that are seen to be able to move us from one level to another as a geography. And having understood them was also another very key point and a pillar in helping us to now refocus and be able to see that, yes, we'll be able to allocate monies, spend monies, and monitor whatever monies they were that we're actually putting in as a district. But also at the end of the day, most of important that for every activity that we do in every program, if we are not able to monitor whatever we are doing, then we sometimes may lose it. So these activities of continuous monitoring, looking at our expenditure, looking at our facility managers being brought on board, sitting with them in meetings, showing them what they could do and how we could do it, has been a very key pillar in also helping us to be able to strengthen our financing for family planning services. Now, the next slide is showing us a snapshot into what we have been able to do from the year 2022 up to where we are today. As you can see in the graphs, that after those series of coachings and co-design workshops, we were able to understand how to commit monies for family planning. The figure that you see, 94% in the first year, did not come from a bed of roses. In the first actually few months, about 3, 4, 5 months, we couldn't understand how to go about financing for family planning services. And until when we had all these coachings and all the CISCO-ASSIST coachings and all the support from all the TCI team, so we were able to understand and now track monies for financing for family planning. The TCI initiative requires at least each geography to spend about 75% of its committed funds for family planning. And we can see that across all the 3 years until this year that we are speaking, we have been able to beat at the very minimum of 75%. And currently, as we speak, before the end of this financial year, yes, we are still at 86, which is still something that is good enough for us as a geography. Next slide. Yes, so with all that mentioned, we have had about 3 big learnings that we have had. Importantly is that we have realized as leaders in the district, that in the local government, that family planning services provision is a key driver for all the various health indicators in maternal child health, and which every one of us on call, I'm sure, realizes. And therefore, financing family planning is the magic bullet for every other geography, for every other country that can be able to achieve the different dividends. Secondly, we have also seen and learned that us as geographies, as local governments, be it in Uganda, be it in Tanzania, be it across the world, it's very possible that we can use our central government grants that come to the facilities, the health facilities, on a quarterly basis. It depends on your country. For us, it comes on a quarterly basis. We can be able to use these grants to be able to allocate these monies and be able to support family planning services and sustain them. A little bit about it, I would like to tell you that, yes, at that particular level, the Ministry of Health in Uganda allocates and directs 30% of every government grant that it gives us every quarter should go to health promotion and health prevention activities. And every one of us realizes that family planning is a health preventive avenue. So definitely we were able to use that and be able to rally the different healthcare managers. As you can see that in the picture, the district health officer, Dr. Diogo, is tasking the managers of the facilities, showing them what they could do and how they could be able to allocate the monies. And finally, having a shared vision as all leaders is very key, because when we are speaking, as we are speaking, we want to tell you that Jinja District has already a shared vision between the political leadership, the administrative units, but also the health department. And this is one of the reasons, one of the key components that has been able to help us to be able to get to the level we are at. And we are trusting that we are going to sustain this particular program. And finally, the next slide. Yes, so this last slide is one of our members of the political side in Uganda, in Jinja District. Rwachaza Moses is one of our key members as a member of the local council 5 here. He said, and we quote, that family planning is managing yourself and your family. It's a very cost-effective strategy to several challenges that are faced by our communities. And they, as leaders, have chosen in Jinja District to speak out in support for family planning, because it has been seen to support and reduce, to reduce poverty levels, among other things, in our region here. Thank you so much for listening. That is our experience from Jinja District.
Thank you, Shem, for those insights from Jinja District. Team, feel free to post your questions on the chat box. Then we'll be coming back to respond to them after the end of all the presentations. We take this opportunity to welcome Nakuru. Over to you, Team Nakuru.
Thank you very much. Good morning, good evening, and I don't know, the ones who are at night, wherever you are. I'm Dr. Joy Mugambi. I'm the County Director, Health, Admin and Planning, Nakuru County, as introduced earlier. And I'm really happy to be here to share the journey of almost 2.5 years with TCI since 2022. And I would say this is a program which has helped teach us how to fish, and not just fish out data from us, but they have taught us how to fish. And we are so honored to have had to work with TCI through our journey of facility improvement financing. I'll share a bit about what Nakuru is as a background. The population is about 2.4 million, with women of childbearing at 633,595. That's an estimate. We are growing in numbers, and health is improving within this county. TCI has supported 106 health facilities in terms of ensuring we have in-reaches, outreaches, capacity building, and ensuring that we are improving our projects within the county. We have a number of activities. I'll focus on the facility improvement financing, which has been a key project that we've had since devolution, but has been enhanced since we started working with TCI. It was transitioned during the devolved government. And at that point, ours was to ensure that we retain 100% of what the facilities were collecting as user fees and insurance claims. Most of our facilities have also been able, through the trainings offered, to engage even private insurers and be able to revenue raise through donors and support that has really assisted them be able to run their programs and finance their commodities. The user charges generated are used to improve health services. They are what the facilities budget for procurement of products and commodities, including of the family planning commodities that they need for their facilities. So as a success, we say hospitals across the counties, having been granted autonomy, it is easier for us to even tell who's a good manager based on how they are being able to manage their resources. They've also been able to hire extra human resource where they are not able to offer services based on their human resource availability. And they've also been able to construct facilities where they need extra service points within their services. We look at what the Facility Improvement Fund has been able to do, inclusive of procurement of commodities. So as a success story when it comes to family planning, ring fencing of the facility improvement fund has led to introduction of specialized services. We've seen family planning facilities being able to also offer extra services like cryotherapy, cervical cancer screening, so as to have a one-stop shop where they are able to offer more within their menu. The department has also witnessed an increase in revenue. When we started off in 2022 with TCI, we had a 1.4 billion revenue collection. We've now moved to 1.6 billion as of 2022-23. 23-24, we were at 1.7, and we are looking forward this 24-25 to reach a target of 1.8 billion revenue collection. With well-maintained infrastructure, we are able to offer better services. We also have staff who are supported for short courses, and this also mainly focuses around the RAMCA courses and also the family planning trainings to improve their skills. We've managed also to be able to pay suppliers on time. And one of the key ingredients for all this is good leadership support from the executive all the way to the county assembly who approve our budgets. And this is because of the advocacy. Next slide. This because of one, the finance clinics that we hold. Through TCI, we've been able to hold several finance clinics, which actually we have managed even to invite counties that neighbor us and be able to train them and advocate for facility improvement financing and get them to benchmark and see what we have been doing. And this actually caught the eye of the president because we now have a nationwide Facility Improvement Fund Act, which is supposed to be implemented by all the 47 counties. Joint work plans is one thing we do with TCI in terms of development and ensuring that our agendas are all collaboratively put together as a co-creation plan, inclusive of joint budget development. We've just completed our budget and we've started our financial year, but TCI was involved all through the budget cycle, from reviewing to designing to ensuring now that implementation is ongoing. And then multi-level advocacy meetings. You can see that's our county assembly member of the county assembly. He's one of our chairs of the health committee, and he was taking the committee through an advocacy meeting where we meet, we engage, we discuss in terms of planning for family planning and also other RAMCA services. With that said, we thank TCI for the opportunity to also share the work that we are doing together. We have learned to fish, and we hope that we'll get better as we move on as counties. Thank you. I hand back to you, the chair.
Thank you very much, Dr. Joyce. Team, just confirm that you were able to type in the chat box. I've opened it up. So as we are doing that, we could move to the team from there. Over to you, Dr. Mary. Waziri or Dr. Mary, are you in the call?
Request you unmute Mary. She's going to be Mary Joseph, and she'll do the presentation on behalf of Mary. Dr. Mary, thanks.
Just a minute. I'm trying to unmute Mary, but apparently I'm not able to. I don't know if Kim could help.
It looks like she's muted right now.
Mary Joseph.
And now she's unmuted, so please try again, Mary. And try turning up your volume. And please make sure where you have your audio that you have selected the correct microphone. There's a little arrow next to the audio that shows what microphone is selected because we still can't hear you.
Maybe Njeri Mbugua, you could step in.
Okay, thank you so much, Kwena, and briefly highlight the successes that Mbeya District wanted to share with us today in health financing. I will start off with sharing the district. The population, it has a population of about 400 age, comprise about 108, 507 persons. And TCI is currently supporting 20 healthcare facilities in the implementation of its high impact interventions. There is a huge amount of increase in commitments towards family planning since they started working with TCI about 2 years ago. And they've also been able to include the TCI high impact interventions within their council plans, activities such as the youth-friendly services, outreaches, and enriches. In terms of the implementation, there has been a lot of support from the political and technical leadership who have been very vocal, in fact, even participating in some of their program design meetings to ensure that they understand what TCI is doing within Mbeya District. And they've been very vocal in terms of supporting and advocating for funds to be released towards family planning implementation. Some of the activities that they've been able to do to strengthen FP financing has been able to develop the capacity of their coaches on public financial management procedures. They've been able to collaborate with national level government bodies since it's a centralized form of financing to be able to ensure that funds are released on time towards the implementation of the high impact interventions. There is also a lot of continuous stakeholder engagement. They do hold quarterly, monthly meetings with various stakeholders, partners, government level partners from both technical and political sides to ensure that they're able to align with the activities that are happening within their district towards improving various health indicators. And then there's also a lot of continuous advocacy efforts, especially with key decision makers at all levels within the governance system. This is just a snapshot of their commitments as well as the allocations that they've been able to do to put in towards the implementation of TCI high impact intervention. And as you can see, they've been able to increase their commitments from the first year to the second year. There was about 197 increase in terms of commitments, which also was commendable to see an increase within their spending of 5%, as well as by the end of this year, we hope to have the data and we will be able to showcase the amount of expenditure. Back to you, Kwena.
Thanks, Jerry, on behalf of the Mbeya team, and apologies for the, for the failure in technology. So let's go to the key takeaways and recommendations. Jerry. So in terms of the key takeaways and some of the things that we are recommending, that the geographies require capacity building on resource mobilization, especially now that a huge number of our geographies are in the post-graduation phase. There's a need to capacity build them on proposal writing, on how to identify donors, donor mapping, just so that the funding for FP continues. There's also need to build collaborative engagement with both the technical and the political leadership. The two teams need to work together for the success of FP financing. And then based on the Kenyan experience, we now have most health facilities having financial autonomy to manage their user fees, that is under the FIF. And this presents to us an opportunity to do some targeted advocacy to the management of the health facilities, just so that more allocation is made towards family planning and the AYSRH activities. Leadership support right across the different levels of the Ministry of Health, because decisions are cascaded down. So all the levels need to be in congruence in terms of how they are prioritizing family planning, and then that is evidenced by the allocation. Continuous advocacy, this has been mentioned a number of times with the public health officers, people who are in charge of budget allocation for the counties, the health committees in the councils, as well as the districts. And this is important to make sure that we don't drop the ball in terms of the momentum that we've gained for now. Next. Next slide, Jerry. Yeah, so in terms of our recommendation is that we need to align our programming to the local government cycle, the budgeting cycle, the annual work plan cycle. And because this presents to us an opportunity to try and push our agenda and, just ensure that all our high impact interventions are incorporated into the geography work plan. Leverage on the political and technical will to improve service delivery. Advocacy with key leadership in terms of data-driven advocacy, presenting the numbers, all in a bid to ensure that the decision makers are actually convinced about the value proposition for family planning. Leveraging with partner networks. There are always several partners within a given geography that are working in the FP space. So we need to create forums where those partners come together and just tap into the information and the resources that are available, all in a bid to enhance the funding for family planning. And finally, just strengthen financial and managerial capacities for the health facility management to make sure that the reporting is accurate, it aligns to the local government, financial reporting requirements, and also that the family planning budget lines come out clearly and are not nested within the overall RAMCA budget. Thank you so much. Jerry, I'm not sure, I think you pulled down the presentation. I think that was, that must have been the last slide. Yeah, I think that was the last slide. So team would open this session up for any questions, any clarifications. We'll probably just go to the chat box. I don't know, from my side, I seem not to access the chat box. Kim, could you help? In the meantime, please feel free to raise your hand and unmute and ask your question. Maybe at this point, we may need to open it up to the team. Tim, maybe you could help in terms of just giving all the participants the rights to open their mics.
Okay, please raise your hand if you want to speak.
All right.
Okay, Kwena, there is a question to the Ginger team. That is Shem. There's a participant who is asking, they are curious to know about overall funding from which you drew funds from, and whether there are any analyses that inform you where the FP funds are coming from. And then also, are the program budgets decreasing, or is the overall envelope responded to this question? So over to you.
Thank you so much, moderator. And yes, the person that has brought in the question is indeed very right that yes, the resource envelopes are getting smaller every other time in every country, in every program. How have we been able to do this? So one, I would like to mention that the TCI program has a theme that it runs with, which is called the business unusual model. The business unusual model means that we do things differently from what we have been doing. I would like to tell you that for every program, for every manager, for every person in whatever office, if you do not challenge them into mindset change and understanding what it should be, then they will always leave the status to be so. So what happened in Ginger is that, as you saw in the recommendations, that one, we had a lot of support from the leadership, and the leadership we are talking about, the technical leadership of the health department, the political leadership, the administrative leadership. All these entities have been very key. And for those that have been in Ginger, you have seen them in the meetings at every one moment. And also the advocacy that we have had with the facility managers. In the beginning, I said that in the very first year of our TCI program, in the very first 2 or 4 or 5 months, we didn't have any monies that we were tracking. But after having been involved in a few numbers of coachings, the district health officer, for whom I showed in the picture there, Dr. Diogo, sat with us and said, now I have understood what we need to do. Go out and start with the general hospital. And so we went to the general hospital. We made an appointment with the MS. And indeed, that was our first starting point, where the general hospital allocated 6 million Ugandan shillings in that particular financial year. It was the very first hospital to allocate monies specific to family planning alone. Now, that gave us an understanding that indeed it would be possible, because then thereafter, we went on to sit a meeting with the facility managers of the different health facility levels. And all of them were given this information. And once they had been given this information, they were required to comply with the policy that I told you that Ministry of Health of Uganda has, that 30% of the central government grant that comes to us to support health services across every quarter should be allocated to health promotion and disease prevention. And I said, and I want to repeat, that family planning actually is a health promotion and a disease prevention intervention. So every facility manager was required to do that. And that is what we are doing as of today. Today, as we speak, all these leaders, and especially the district health officer, you can never bring to him and all the accounting system personnel, we can never bring our accountabilities to them if we do not show an accountability or an expenditure for family planning. And there should also be value for money. Now, as we speak also currently, we are in the planning cycle, which has just ended. Now we are into the new financial year. Every facility that is making a new work plan and budget for the next financial year that is running now, July onwards, if anyone did not have any part for family planning, he or she is asked to go back, sit again and rethink, put family planning into the budget lines and be able to bring it back. And once they have been able to show that, then our role as leaders at the top is now to later monitor and see how they are using the allocated funds to be able to support family planning services. So the envelope has not gotten bigger. It's a realization of the need to support family planning as an entity, as an intervention on its own. And we are still using the same resources that even we had before. It's about mindset change. Thank you so much. Over to you, moderator.
Thanks, Shem.
And we have Janet and Lena both have questions and they can speak.
All right.
Janet, do you want to unmute and ask your question?
As we wait for Janet, Shem, just another one for you for clarification. So not programs are losing budget in favor of FP gains. That's a question to you.
Thank you so much once again. The other programs are not losing budgets per se. Just like I mentioned, that our policy here say 30% of all the monies that we receive should go to health promotion and health disease prevention. So the question was, how well were we utilizing our funds? And upon realizing that we were not actually generally some of the times using our monies for the very right causes. For example, we have evidences of facilities that were allocating monies, for example, for UNEPI, that is vaccination outreaches. And somebody does a vaccination outreach and only brings just one child, and that person has spent quite a big sum of money. So where is the value for money? So it's just persons that have been challenged to understand that for everything that you attach, there should be an indicator that is either being improved, but also there should be value for money. So the other programs haven't actually generally lost money. We have actually been able to understand how to realign our budgets to be able to speak to the different indicators that are required of us. Thank you.
Thank you, Shem. Any other question that any other person that needs to make a comment or ask a question? So there is a comment from Faith Marete. M&E support for TCI activity outreaches and enriches at sub-county level need to be communicated and strengthened. All players not always informed when the activity is happening. Thus, M&E team cannot be able to account for contribution of over all family planning performance. Faith, that is noted. Janet, thank you presenters for great presentation. No question. Anybody else? We do have 2 minutes remaining. I want to ask Kim to give, to open Jerry Nyamu's mic so that she could make some comments. And yeah, thanks.
Okay.
Hello, everyone. Can you hear me?
Yes.
Oh, great, great. I'm lucky enough to not fall into the technical challenges, but real briefly, because of time, I just want to first of all thank the team, the presenters, the team that came together to put all this presentation together and host us, including Kim and everyone who is here participating and giving us audience. We really are grateful for the questions and just your participation. I've been asked to just say one wise word. And I think from the message that you've seen, it's very clear that we have to work with our governments. Our governments already have the structures, they already have the people in place, they have the systems that we need to take family planning, whether it's financing or it's actually service delivery, or even the commodity availability, whatever component, to the larger scale and to do it sustainably. So what we are pushing for is a government-led, a government-driven approach, and partners are able to support that with the government leading at the front seat. So once again, thank you so much. And I'm looking forward to more interaction and probably more questions and more instances for you to hear about TCI East Africa and the TCI family at large and the great work that we are doing. So thank you once again, and over to you, moderator Godfrey. Thanks.
Thanks, Jerry. We have one of our country directors for implementing countries. I've seen the country director for Kenya. Maybe just in a minute or so, just you could make a comment as we close. Kim, please unmute Paul.
Sure. Paul. Sorry, what name do you want me to unmute?
Paul Nyachai.
Oh, I don't see Paul.
Okay, maybe he dropped off.
Yeah, I'm not seeing him in the attendees.
Okay, that's okay. I think we can close at this point. Thank you so much for finding time to listening and make your contribution. Have a good evening. Have a good day. And see you. Bye.
Bye, everyone.
Bye, everyone.
Thank you
Bye.
and bye,
Thank
everyone.
you.
Bye.
Bye.
Thanks.
Thanks, presenters.
Thank you.